Hi, everyone. Thanks for coming to the Awake and Thriving podcast. Today we have with us Dr. Anita. She's a board certified MD for over 35 years. Welcome, Dr. Anita.
Hi, thank you so much for having me today.
Yes, definitely. We talked a little bit before we started recording about kind of what brought you into functional medicine. I'd love for you to tell our audience that because it's kind of moving, and getting your point of view about that will open people's eyes a little bit to what's going on with healthcare right now.
Well, since I've been practicing medicine for such a long time, I've seen how it's progressed. And so I would see people, the chronic diseases starting to become a big play, and just seeing the quality of life becoming worse and worse. And I would save people who had multiple chronic illnesses and multiple emergencies and resuscitate them over and over again. And this one day, this gentleman, did my thing. I'm trained to save your life. You come in an emergency, your heart stopped, I am going to resuscitate you. And usually the patient, the families, everyone is happy that you've restored them and give them another opportunity to carry on. And this gentleman looked up at me with the saddest eyes and looked at me and said, "Why did you do that? Can't you see my quality of life is so poor? Why would you do this to me?" And I was just so taken aback. I was just like, oh my God, this is what I do. I save people when they're at the worst of their worst. And then that's when it really opened my eyes, because I do a lot of preventative medicine in the emergency room. And I had so many people ask me, will you be my primary care doctor? Because they say, if someone had just told me to do these things, I wouldn't be where I am now. And I would go through all these things, tell them, what you should eat, what you should move, you should do all these things and all these things. But in the ER, it's too late. So I ended up studying functional medicine and moving, trying to prevent people from being their worst to worst. So and do preventative at the beginning. But I can still work on the after, because I would have a patient that would come in. And as I was telling you, that the people are in these three categories. They have the acute medicine, emergencies, and that easy. We know what emergency procedure to do. If they came with a gunshot wound, I would crack their chest open, and then I would repair the hole and get them to surgery. Or if you have a really sick and you need to be hospitalized and need further care, you know what to do. But then the big gray zone area of people who would just come back in emergency medicine, we're trained to take care of you and move on to the next, right? Well, these people would keep coming back, and I would say, go to your primary care doctor. This is a chronic problem. This is acute care medicine, emergency medicine. This is not chronic care. And they say, but I've seen them, and I've seen the 10 specialists that they send me to, and they haven't done anything. And you're the only one that knows me as how sick I am. You're the one that knows how I'm like, but you're not having an emergency, and you're not sick enough to be hospitalized. This is a chronic problem. So I ended up studying some functional medicine, and I saw this gentleman. I must have seen him for 5 years, coming in with this belly pain. He was always agonized. He was miserable. And finally, I had a moment one visit. I had some time, and I sat with him, and I went over through his history. I took a functional medicine history and went through it. And then I told him, you know what? I think what you need to do is cut out gluten. And so I gave him his morphine. By the time people come in, they get labeled, that they are seeking drugs. And I got him out of his pain, got him out of his emergency, sent him on his way, got him hydrated, did all the things, and gave him that one piece of advice. I didn't see him for the next 2 years. I was like, I didn't really think about it. But one of the nurses in the ER that I was working with happened to be a friend of his. And she never told me, but she said, remember that guy we used to see all the time in the ER, and you would treat him for his pain? Well, I'm a friend of his, and he wanted me to thank you because he did what you said, and he took out the gluten, and he hasn't had the pain anymore. So that's why you haven't been seeing him. That's how I got into functional medicine.
Wow, that's amazing. And I love to hear that. Just like one little tweak sometimes is all anybody needs in order just to make a big change in their life, like not going to the ER all the time.
I know, and and it's not the primary care physicians, fault. It's the training, it's the way we have developed medicine. So it's not that. So I wouldn't, I'm not trying to disparage any primary care physicians because they do great jobs and wonderful work, and I definitely believe in that. So that's not what I'm doing.
And what is the difference between, say, for instance, a functional medicine doctor and a primary care physician? Because people will get confused by that a little bit.
So, you know, and conventional medicine, I like to say it's more reactive, right? So the primary care doctor, that what we're trained of in medicine is to add up all your symptoms, look at all your data, and see if there's a disease. If there's no disease, you're healthy, because the definition of Webster is absence of disease is health, right? But then for me as a functional medicine doctor, you have brain fog, you have headaches, you have itchy skin, you have allergies, you have constipation, you have diarrhea, you have bloating. None of those adds up to disease, and all your labs are all normal, but that's not healthy. So the primary care physician is paramount important. They're looking for those diseases. And if they don't find the disease, because they're doing mammograms and pap smears and colonoscopy, but guess what? Those are early detection, not preventative, as they say. They say they're doing preventative medicine, but they're waiting for it to be at a disease state to find it and be able to treat it. So that's reactive. So what functional medicine is being proactive. I'm taking all of those things that are not a disease and trying to make you optimal and make your cellular function work optimal. And so the primary care physician uses a cardiologist, an endocrinologist, a rheumatologist, and they should use me, the wellness specialist, right? Who is going to check and see how well are you? Are you actually healthy? Because I have plenty of people that come in and say, oh, I'm very healthy. I think my health is very good. And I eat a very healthy diet. And then I go through my wellness assessment test, and they'll have, intermittent diarrhea, constipation, a little bit indigestion. They'll have a little itchy ears. They'll have a little headache now and then. They get a little moody now and then. They have a craving for sugar. And I go, okay, add all these things up, and I have a score. And if you're from 10 to 50, that's what I say, mildly unhealthy. So the mildly unhealthy people are generally feel pretty good. Take a little allergy pill for my nose, take a little fiber for my constipation, I'm good. Take a little Tums for my indigestion, I'm good. They think they're healthy. And I'm going, oh, that is so not good. Something's not working in your body. There's a systems problem, because I'm a system analysis. I'm the whole body thing. And in conventional medicine, they say you're born, you're vital, and we decline. How depressing is that? In functional medicine, I say you're born, you're vital, and we maintain. And you can maintain that vitality and everything. And then you drop off, right? But you die well. You don't die of diabetes, heart disease, hypertension. You don't die of these things. So that's the difference. I don't know, maybe I went overboard, but I think that was the answer to that question.
Well, what you just said that, and I love hearing, because I'm not in my 20s anymore. And when I speak to certain people, I actually don't like talking with them, because they act like once you get to a certain age, it's downhill. This isn't 200 years ago. We don't just have children, get married, and die right after teenagers. That doesn't happen. But that's still ingrained into a lot of people's mind, especially women. Women feel like they get to a certain age and just fall off a cliff, are not needed anymore. It's so sad.
That was the main thing that I saw in the emergency room. People coming in and going, golden years are not golden. And I'm like, well, can't be true, because I see plenty of golden people people that are aging gracefully and have a good quality of life. So that's where also a little thing, what is the difference there? So I study anti-aging because, I'm getting older. My parents are getting older. I want to, have everybody have that vitality to the end. And so that's what the point is. And so golden years can be golden. And if they're not, there's just too much inflammation in your body.
Oh, I love that you hit on inflammation in the body, because that's something that's actually been going through my mind a little bit. I don't know why it popped up in the last few days, but I was thinking, how can you tell if you have inflammation of the body? What are the signals for that? Is there like a lab you draw? What do you think about that?
Well, there are specific labs that you can draw for inflammation, and I definitely check those. And your primary care physician checks some of those too. And so those are, inflammatory markers. So you want that, and even the cardiologists, American Heart, they are acknowledging inflammation. That even heart problems is now an inflammatory reaction. So any symptoms really that you have in your body is really a symptom of inflammation that causes disease. So I tell all of those football players, the athletes, they come in and they go, oh yeah, I just got all these aches and pains and it's all bad. And I say, well, you can measure your inflammation by your traumatic arthritis, because we can't take that away. There was a trauma, there was an injury, and now that there is a weakness in that area. So when you overindulge in alcohol, when you don't sleep well, when you eat a lot of sugar, when you eat a lot of processed foods, I bet that knee joint hurts a lot. Now, if you cleaned up and ate a lot of fruits and vegetables, got good sleep, and you did some good exercise, keep the muscles in shape and warm, and had less alcohol, less sugar, less processed foods, I bet the knee feels better. That's how you know about inflammation. So wherever your little nidus is, you can tell. So I always, that's that. So, and you can correct those things. So if you have seasonal allergies, if you have allergies, there's something going on in your gut, right? So inflammation, we can test and we can look, and then there's micronutrients that we can look at, a whole host of things.
So when somebody goes in initially for a visit with you and they have allergies and maybe some skin issues, you're going to go over like, how would that visit start? And would you order labs at the end? Just, can you walk us through what that would entail?
Sure. So on a general wellness, so that's one that's simple. I don't go into a detailed functional medicine history. I just kind of, because people just want to know how well they are. So, and they don't want to necessarily do all the hard work it takes, because when you're doing functional medicine, there's a commitment and a mindset, and there's a commitment for a lifestyle change. Okay. So when somebody comes in for a general wellness, I don't know where their commitment is on there. So I'm not going to drag them through everything, because they may not want to know all that. So I'm going to just go through a basic history, finding out about what is bothering you. And I'm going to give you that wellness questionnaire. And based on that, I can pretty much tell how well you're feeling. So I had someone that came in and her score was, and so she was pretty motivated. She had not a big budget, but her score was like 129. So she was severely unhealthy. And that's why she came in, because she had heard about something I had done. And she said, I didn't know that this could be corrected, because my doctor said I just have to live with all this. And I'm like, no, you don't. I said, you are so unhealthy. Let's fix this. So I gave her the score. I looked at all of this. And because she didn't have a big budget, I just had to focus on what the history was. And so for hers, it was showing that her gut was totally not working right. So right now I'm cleaning out her diet, and she didn't eat right. And I took a diet history, all of that. So I'm cleaning her diet up. And then depending on, what I will go through with each person is depending on your budget, because there's, the labs are extra fees, and those are not something I have in control over. Though the good thing, though, is that they are covered by Medicare, 2 of them. And they are not covered if you say it's for preventative or for wellness. So you can, because insurance is based on disease states. So that's how our system is set up. So it's not a fault of it. It's just the way our healthcare system is set up, and it's not functioning well, but it's function on a disease state, because that's the way it was set up years ago. But so if you put down anything is for wellness or preventative, it's not covered. So for Medicare, we have to, put something down. A symptom may be able to. But so there are these micronutrients. I test for micronutrients to look and see your antioxidants, your B vitamins, your minerals, your detoxification, your fatty acids, see how well your all of these things, your glutathione, to check and see these levels and see how your cellular mitochondrial function is working in the Krebs cycle. And we can see that. So if you don't give them all the cofactors, that your mitochondrion, which is the powerhouse, and to me, it's the fountain of youth. If your mitochondrions are just weak and aren't getting what it needs, you're not going to have any energy. You're not going to feel good. So you've got to feed that, right? So I can look at it and say, okay, this is where you're deficient and this is what you need. And that's the micronutrients. Then we have the gut test, which will look at your gut to see how your microbiome, how well you're detoxifying in that, how well it's balanced out. So that there's the gut brain immune. You talked about someone with the skin. So if your gut's not healthy, you're going to have itchy skin or have skin problems, and you're going to have brain issues. A gut on fire is a brain on fire. So it's going to be that complex there. So we look at the gut. There's another one when I look at hormone patterns. So the way you digest, or the way you metabolize your estrogen. When you metabolize your estrogen, I can look at your liver to see how well your liver is detoxifying in phase 1 and phase 2. So I'll look at that. And so the metabolites of estrogen metabolism can really predict whether or not you're going to have one of those hormonal cancers, ovarian, breast, and men can get breast cancer, breast, prostate, uterine cancer. So we look at those things. And also I have a test, if you're really concerned about autoimmune, I can predict whether or not you're going to have autoimmune disease 3 to 10 years prior to symptoms. Mm-hmm. So there's things that, so I always say, let's test, don't guess. And, it would be better, but I can make educated guess based on the history, because testing is expensive, but we can get more information and just kind of fine tune it. And so so then from that budget wise, then we look through there and they'll make some suggestions on their diet and, lifestyle and things like that. Because pretty much what I say is there's 4 pillars of health. And if you're not doing any of the 4 pillars, we're not going to do anything but work on the 4 pillars. And the 4 pillars are basically food. You have to eat good, clean food. So no processed food, right? So if you're eating, the big gulp and, fast food and everything comes from a box, that's got a problem. There was a 15-year-old who was an athlete. He was socioeconomically not well off, right? So his family was used to using food stamps, whatever. So they bought boxed foods, everything that they could get, right? But he said they never ate any meals that were cooked at home. They didn't sit down together. He ate everything came from a box, all of this. But he's a strapping 15-year-old and an athlete and being looked at by colleges, right? And he was running on the track and he broke his hip. Now, how does a 15-year-old break his hip? You know what? When they tested him, his bones looked like an 80-year-old. And you know why? Nutritionally, he was malnourished. He wasn't getting any of the nutrients that his body needed at the age of 15. I think he's now in his 20s or 30s. He has now corrected that because and has learned a lot and gone into functional medicine and is taking nutrition. He's written a book now, Eat Smart, I believe. I forgot his name, Sean or something, but he has turned it around, and now he has reversed all of that because he's corrected his nutritional deficiencies. So that's the micronutrients that I look at. So food is very important. Food can be poison, or food can be medicine. So food is the first pillar. The second pillar is movement. If you're sitting on the couch all day, or you work at home, you roll out of bed, roll into your chair, get on Zoom and do all that, and then roll over to the dining room table, eat your meal, roll over to the couch and watch the TV, and then roll back into bed. You need to get up and move because our bodies were meant to move. So the more that we move, the better your body functions. So you have to move. And actually, it's just the daily. And if you don't like exercise, if you don't get that endorphin rush from exercising and you don't want it, but just think about this. They did a study of the, I think it was in Kenya, it could be Tanzania, but, and they studied the natives there to see how much exercise, how much movement was in their bodies, because they're lean, they're strong, right? And they're carrying buckets of water on their heads to the river and back. And then, but what I noticed when I was in Africa, they're always sitting all the time. And I was like, they're just sitting around. I said, what are they doing? And then the study really made it hit. They're conserving energy because they have to walk to the river. They have to tend to the goats. They have to tend to the fire. They have to go pick the firewood, the kindling. They have to do all this activity. So they're always sitting to rest. And so when they studied them, they actually sit 10 hours a day, but they move. So I don't say that we were not designed to exercise. We were designed to move. So you got to move your body. So if I tell somebody, if you're sitting at your desk, which I'm going to do right now, I sit at my desk and I have this elliptical. So you have to have the desk at the right height, or, now we have those standing desks and things like that. So right now I am actually doing elliptical. I'm moving my legs. I'm moving, right? So you got to move. So I'm going to do my little bit of a movement now. If you see me bobbing around, I'm going to do my movement. And then I have a punching bag over here too. So I do that sometimes. But so, because now that when I'm not in the ER, where the ER was doing a lot of moving, but when I'm in my office, I do a lot of sitting. So I like to get some movement in. So movement. Third pillar is mood. So if you're that negative, pessimistic, half glass full kind of person, doesn't matter. You just have to have an aha moment. You have to have a joy. You have to have a laughter. You just got to laugh, and when you laugh, that guttural in back here, and I do a lot of humming, and I like singing and or whatever it is, because that will stimulate your vagus nerve and calm things down. So you need that vagus nerve stimulation, and you need laughter. You need joy. That's 4. 5 is 4, I call it relaxation, but that kind of encompasses everything. So you need to have restorative sleep. You need to sleep well. You need to, if you can't sleep well, if you can't restore your body, because our body heals itself during sleep and rest. So meditation, all of those things help. Relaxation, downtime, escaping. And I'm just going to take a moment to tell you my little take on it, because I always think that people need help to understand meditation for me, because I always see that it's on their to-do list. I got to answer this email. I got this deadline. I got to get that meditation in. Oh, I got to do it first thing in the morning. I got to make sure all these lists and they're doing this. And I say, okay, what is this about? And what is it? So if you think about it, we're still hunter-gatherers, still cavemen. Let's take us way back. So you're that caveman running in that open plain. It's just fields wide open. And there's that panther behind you. I used to say dinosaur, but my 14-year-old son told me, that's the wrong error. Dinosaurs and cavemen were not together. I'm like, okay, I'll correct that. panther. So the panther is chasing you, and so you're the caveman, and you're running in this open plain, and a panther's chasing you, and you just have to keep running because there's nothing to do. That's that phone call. That's dinner. That's got to go meet my friend. That's I got to do that report. I got to go to bed on time. I got all these things, right? So then let's take that caveman and put him in this jungle where it's lush and there's caves and there's nooks and crannies, and the panther's behind you, and you're running, and you go, oh, look there's that cave with like foliage over it. You duck inside, and the foliage covers it, and the panther runs by, and you're inside the cave. What's the first thing that happens? Your breathing slows down. You start to slow down your breath. And what happens? Your heart rate starts to slow down. And then what's the next thing you say? Oh, I'm safe. I don't have anything chasing me. I got nothing to do. Who cares about the deadline? Who cares when dinner's going to happen? Oh, I'm running late. Who cares? They all go away. And if you just do that 5 minutes in a day and take it, and I say do it at 10 o'clock and 5 o'clock, and just go, take 5 minutes for yourself and escape, and nothing else matters but that breathing, slowing my heart. Oh, I'm so glad I don't have to do anything for 5 minutes. I'm so safe. That's what meditation is. It's not like, oh, I got to get that mantra right. I got to get this thing. I got to clear the mind. I got to do, it's just about getting the vagus nerve, calming down, relaxation, restoring the body. Because if you're in the fight and flight mode all the time, if you're in that go, 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 go mode, you got to get into that rest and digest in that parasympathetic. So there's the parasympathetic, which is the more relaxation, vagus nerve, and rest and digest. And then there's that fight or flight mode, which is all the deadlines, everything I got to do. I'm like, got to go, super energetic and all that. You got to have those two balanced. And when you can actually do that, that's that relaxation. And that's when we go to sleep, right? And that's part, you have to have that restore. Those are the 4 pillars. So when I have somebody that came in for me, this is a long story for you, the answer to the wellness. When she came in for the wellness assessment, I went through her whole thing, and I was like I said, okay, you know what? Let's not worry about it. You need to do these 4 basics because she didn't eat right. She never moved. She was a negative downer person and never laughed. And she doesn't sleep. I was like, we need to just go to the basics first before we can go to any other next step, before I do any testing or anything. Because if we just cleaned up these 4 pillars, maybe everything would get better. Maybe you would have energy. Maybe you wouldn't be so, depressed. We would just let's just clean, all of that. So those are the 4 basics. And so I usually tell people, go see anybody else or come see me. I don't mind, but work on these 4 pillars. Once you've done these 4 pillars as perfectly as you can, then you come in, and then I'm going to fine tune each one of them and find out where is it breaking down in your body and your system? What's breaking down? What's not working? And then we're going to adjust it, because maybe the keto diet you put yourself on is not the right diet for you, right? Maybe, maybe whatever it is. So we're going to, there's 5 things that I look into. So I don't know if you want me to go into that much detail further.
What I wanted to circle back to is you were talking about the liver and estrogen metabolization. That's really interesting to me. How does that, so the liver plays a part in detoxing and working with all the hormones, right? Not just estrogen, but a lot of women have problems with excessive estrogen. Is that?
Yeah. Well, yeah, if women can be estrogen dominant, and when you're estrogen dominant, you can tend to be insulin resistant. And when you're insulin resistant, you're going to gain weight, right? So that's pretty much is that you're just not, your hormones are not in balance. And even when you're going through menopause, you're still going to have, you're not losing your estrogen. It's just you're not having the reproductive organs are not producing it, because estrogen is vital for brain function. So if you don't have enough estrogen, you're just going to be kind of confused. You need to have estrogen for mental alertness and functioning. But I use how estrogen is metabolized to show me some of the detoxification, because it goes into what I call the three, I call them the good, the bad, and the ugly metabolites. The good metabolite you want, and when I get this pie chart, it would be, and I typically use the Dutch test, that it gets a pie chart that gives you, 80% of the good, and then 10 of the other two. And so if somebody comes in 60, 20, 20, then I kind of know their first liver path is not working that well, and they need to clean up their diet because they're metabolizing it not quite right. And we want to shift 80% of it into the good guy, and then 10% to the other two. And then the good guy has to get methylated. So you have to give a methyl group for it to further detoxify. And 30 to 40% of the population has a methylation, a mutation or it's called a SNP, a mutation in that gene in detoxification. That's the MTHFR gene and COMT. So that people have a problem with methylating or giving off that methyl donor group to further detoxify whatever we take in. And then the bad guy is basically just needs to be eliminated. So you eliminate it by sweat, by breathing, by urination and defecation. So if you are constipated, you are recirculating toxins. So if you're not going 1 to 2 times a day, you're recirculating toxins. So you want to go, some people say up to 3 times a day, but then I think that's if you're eating a lot. So if you're eating just an average amount, I would say normally should be about twice a day. So that's the bad guy. And the ugly guy, when it gets there, those guys has to be further neutralized by glutathione. And glutathione is our own internal antioxidants. You have 3. You have SOD, catalase, and glutathione. And unfortunately, they diminish as you age. So that's one of the markers that I look at to see how good your levels of glutathione. And so you want to maintain that glutathione, because though, especially if you're going to not clean up your diet and your first liver pathway is bad and you have 20% and then your glutathione is tanked, then you're going to get ovarian, breast, uterine, or prostate cancer. So if we can increase your glutathione levels, help you neutralize that 20% if you don't want to clean up your diet, and maybe reduce your risk of hormonal cancers. So that's how that works. So that's how I do it.
And the way that you would address, say, the liver stages you were talking about, is there a way to address that naturally, or is that something that would take other forms?
So, everyone talks about detoxification as if it's something that they need to do as an extra step. And I'm kind of the extra opposite way. There's not a detoxification program that I think is better than one or the other, because you need to detoxify daily. So having a bowel movement once or twice a day, that's detoxifying. It's taking your liquids and your hydration, that's detoxifying. Taking your cruciferous vegetables and eating a lot of vegetables, that's detoxifying. Taking your chlorophyll, getting all that you need, enough fiber, and making sure everything works. So you're detoxifying. So it's a daily thing. So what I know is that I have a SNP or a mutation in my good guy, that the good, bad, and ugly guy in my estrogen. So I have a mutation in that pathway, and I have the MTHFR. So I don't detoxify very well naturally. So if I wanted to eat processed foods, a lot of gluten and a lot of sugar and all that, and never eat a vegetable, I'm going to end up with a big problem somewhere along the line. right? So I need to make sure that I eat pretty clean. So I eat organic. There's the Dirty Dozen and the Clean 15, and I eat pretty organically. I take a lot of greens. You need 9 cups of greens a day, 6 to 9. To me, that's detoxifying daily. And staying hydrated, taking my fruits, my vegetables. I don't do it perfectly all the time. And when I don't, I go, you know, that toe that I hurt when I was surfing, it's hurting me now and I can't wear my high heels. So I know I need to cut back on alcohol, sugar, the brownies I like, and the, you know, maybe I had some, you know, more, you know, simple carbs, and I'm going to step up so that's detoxification to me. But yes, there are people who like to just eat all the things that they like to eat all the time. And then they're going to do a detox, and I'll put them on a fruits, vegetable detox for 9 days, and they get cleaned out for a while. They feel so much better. And then they go back to their old ways. Now that's not the way I like to do it. I like to do a lifestyle change, and you eat like a clean way. And then you have intermittent, you know, falling off the wagon intermittently of whatever your favorite things are. So that's how I think of detoxification. That is an ongoing process, constantly doing it. But for me, as personalized medicine, I'm going to look at your genetics, I'm going to look at your cellular function, and I'm going to tell you what I think, how you need. So if you have no SNPs and you have no problems in your phase 1 and 2 are as good, and you like all the alcohol and you like all the processed foods and everything's looking good, I'm like going, okay, I guess you just add a little greens in here, this little part, it looks okay for you, and do a detox every, you know, 9 months. Maybe that's good for that person, and they are going to live long and not have any problems. Then you have a person who has, you know, a mutation here and another one here, and then they're not cleaning this out and this, and they're all this out. And I'm like, oh, we have a lot of things we're going to have to change on you. And you really should probably do like a, you know, a daily thing. Or if you really don't want to do that, let's do a detox monthly. So it's going to be personalized, and it's going to be on how you want to do it, because end of the day, it's quality of life, right? So if you're doing all these things and you don't find it improving your quality of life, we're not going to do it. Yeah. We're going to do what's going to give you a good quality of life and to make you be vital, be born, be vital, and maintain as well as you can. And maybe you'll drop off a little because you don't want to maintain that well, and you're going to live well, you know, up to the point that you want to be.
I love that you say maintain instead of, like I told you previously, instead of like getting to a certain age and everyone's like, oh, you drop off. And I was like, I feel like I am super young right now. I'm not going to be dropping off any cliff anytime soon.
No.
So I do love that. I wanted to know, is there any recommendations you give is there anything that when you see your patients that across the board, they usually have deficiencies in, any supplements you recommend?
Across the board, generally, you know, omega-3s are really good because omega-3s really help inflammation, right? But you know, you want to, and I think in the United States, most people here are vitamin D deficient. So, but I always like to test. I don't like to guess in terms of what are you deficient in. But you know, we always talk about, you know, CoQ10 is good to keep your mitochondrions. It's a baseline thing that the mitochondrion needs. There's so many things that we could use, but I really like to test. But, you know, number one is omega-3s for inflammation, because I'm always trying to bring down inflammation. And then the rest is going to be what you specifically are deficient in, or, you know, where you are on the chronological phase. And what I try to do is make your biological age younger than your chronological age.
So I want to ask you a fun question right now. And I'm always excited by this question. It's a simple question, but some people's responses I'm not expecting. What is your favorite breakfast in the morning?
My favorite breakfast. Okay. Well, I would have to say that I do a green drink. So I take, because I'm always concerned that I don't get enough of my greens. And I also do some redox cellular signaling type things. So I take turmeric, ginger, lemon, and then whatever greens I have. And if I actually purchase greens, I would get celery, cucumber, parsley, cilantro. But today I ran out of all of those. So I had some celery, and I have my little garden. So I had some mint, and I had some basil, and I had some parsley, lettuce that were colored, the red colored lettuce, and some Boston lettuce, and some kale. I threw that in, and then I always throw in extra greens. So either green spectrum or from Purium, but I use a green vibrant, and I throw that in. I put in collagen, marine collagen, because I want to make sure I have enough collagen. And then what else did I put in there? Yeah. And then I'll put in, I put my magnesium in there because I don't like to take all the pills. I throw the magnesiums in there. And I'll throw, what else did I throw? My nitric oxide is a little low right now, so I put in some nitric oxide, and then I put in, unfortunately, my sons haven't taken their multivitamins, so I threw in their multivitamins that they're not taking, so I would get some extra because my B vitamins are a little low. And then I have a mutation in a clotting, so I put in some arginine, which is a Chinese herb, an Ayurvedic herb that I use for cardiovascular to keep my blood thin, and some ashwagandha, because I always think I'm probably stressed, which I don't know it, so I throw that in there. And then astragalus for strong immune, and I blend that all up and I drink that.
Wow.
That is my morning ritual. It's a quick breakfast, and it gets me hydrated and make sure I take care of all of my issues.
Wow. That's a big list.
But it goes really quick. It takes me less than 5 minutes to do, whip it up, and I'm gone in the house, and I have it. And it's, I'll show you. It comes in my, I drink it when I get to the office right away. That's how much it is.
It's
so
pretty big.
Drink. Yeah. So that's my drink that's my.
Oh, wow. All right. Well, Dr. Anita, is there anything closing any tidbits you want to give anybody? Because it's been a pleasure. Everything, I feel like we went over a lot, but I feel like we've just scratched the surface.
Yeah, no, thank you for giving me the opportunity, because I think functional medicine is maybe misunderstood. And I think that people need to understand that it's not in place of conventional medicine. It's just another tool, because I use conventional medicine, functional medicine, Chinese medicine, Ayurvedic medicine, and it's just integrated all together. Because I'll just give you one last story. I'm sorry, is that when I went to study in China, because I trained in the United States, I knew all about Western medicine. And my dad was all into Western medicine. You know, he's from the old country, and he says, Western medicine, that's the way to go. So I studied Western. But my grandfather was very old school and would send me to Chinese doctors when I was young. And so I learned about Chinese medicine. And then I really wanted to do acupuncture. And then I went, and so I went to China and I studied, and I just got tired of studying and memorizing. And I just was like, kind of quit after 6 months of Chinese acupuncture. But I was in the department of Chinese medicine, because I said, I don't need Western medicine. I just want to learn Chinese medicine. So I was in Chinese medicine, learning everything, but I didn't finish the acupuncture, but I use acupressure. But anyway, and then there was this other little small department in the middle that was Western and Chinese medicine together. And I thought, that is ridiculous. And what is that department doing? I was like, so I was all into Chinese medicine, learning all that. Then I came back into the United States, and then I said, what was I thinking? I should have been in that department, because you need them all. You need to blend it all. It's not just Western. It's not just Chinese. It's all of them together. You have to blend them all together and use them. And that's my thing. It's all, it takes a village. Yeah. You need somebody who's got a tool chest that's a lot bigger than just one area.
I love that. I love that you said that. You mentioned Chinese medicine, mentioned even Ayurvedic medicine, acupuncture, all of those, because I do believe that combining all those together really does help optimize your health for the long term.
Yes.
So, all right, Dr. Anita, it's been a pleasure. I am so happy to have had you on. I feel like we've covered a ton of stuff in a short amount of time. And like I said, we've just scratched the surface there. So thank you.
Thank you so much for having me. I appreciate it.